Hello and welcome to the Desperate for a Diagnosis podcast. I am your host, Laura Nozicka, and I'm here today with this is actually pretty cool because I normally only have one guest on. I think there's only been one time that I've had two guests to volley my questions to, but today I have two guests. I have with me Irene Woerner and I have Paul Evans with me today, and they are working with a company called M Truth, M as in Mary, Truth. And the reason I'm excited about this topic today is that their passion really rolls over quite easily with what they're doing with their company. And M Truth is a company that is helping patients own their own data and control what to do with it and who gets to see it. And I think this is going to be a very enlightening conversation for so many of us because, Irene, as you say, we are all patients, and it's so important to understand where our data is going, who's looking at it. We've heard about so many data breaches happening within hospital systems, et cetera. And I think it's just going to be, again, very enlightening and talking through some of the solutions that M-Truth has been implementing and gaining steam and popularity. But let me do a little bit of an introduction of both of them before we get rolling here. Irene Woerner is the CEO of M-Truth. She is a software innovator and expert in executing complex, first of its kind technologies. Before M-Truth, Irene spent many years at, okay, hang on, everyone, NASA JPL, and was responsible for flight and ground software on a mission to Pluto. Oh, just Pluto? That's it? The little guy? Come on. That's no longer a planet. It's so sad. I know, poor guy. But happy to acknowledge Pluto today. So while at JPL, she also led a team of researchers on advanced information systems. Irene was a technology consultant to Fortune 500 companies in industries like entertainment, engineering, and academia. Irene is an inventor, author, and speaker. Paul Evans, he is the CRO. And what does that mean exactly, Paul, CRO?
I make coffee, chief revenue officer.
So perfect. So Paul Evans, he is the chief revenue officer of M-Truth. Paul is a problem solver, marketer, and strategist, helping found a pioneer healthcare professional social media and insights platform. And Paul has 20 plus years of experience in healthcare research. Paul actively supports healthcare charities through various fundraising initiatives, including Ironman competitions, rides, runs, and is planning to cycle across America. Man, the two of you are, I think, the most underachieving people that I've interviewed so far. I can't stand it. Like, I just ballroom dance for a hobby, but when
I'm not athletic.
You got NASA and Pluto and Ironman, I don't know how I compete with that.
Ballroom dancing, and I do it badly. I'm very much a Danny Glover sort of situation right now. I'm getting too old for this bleep. But
That's funny. Yeah. Well, you're never too old, and I always say if you have the right information, anyone can dance. But that's my philosophy of my hobby. But thank you so much, both of you, for being here.
It's our pleasure.
Cheers. Thanks for having us.
Awesome.
There's a good reason for us because having two people on this, because as we kind of joke, Irene has to translate this heavy London accent every so often, and yeah, I help translate some of the NASA talk sometimes as well. So yes, normal words, Irene, normal words, things that I will understand.
Use your normal folk language, right?
Yeah,
bring it down a level. But like I said, Paul, I just, you could just sit there and say the word bananas as long as we want. As far as I'm concerned, just bananas, and I'd be happy to have you on my show any day.
Banana and vitamins. Let's just talk about that.
Love it. Love it. Well, this is, I think, like I said, is going to be a very enlightening conversation because it is one of those things of healthcare, which maybe we take for granted, maybe not. But like I said, a lot of the data breaches that have been happening in healthcare, I think, have been coming to light more often in the news. And then how often are we getting those letters that come from our doctors' offices or our hospitals that we visit where they say, recently your data has been breached, et cetera, et cetera. And I think it's just, we're becoming more aware. But let's kick things off. Irene, why don't you tell us more about M-Truth and what your philosophies are and kind of what the platform or what the company does first, just kind of broadly speaking. But then let's get into talking about this very confusing, kind of murky field of patient data and how it works.
Yeah, absolutely. So thank you, first of all, Laura. We love being here. We love your energy, and we look for people that, share our values in terms of trying to advance, what patients need. Ultimately, that's what we do. So, but let's talk about M-Truth, right? M-Truth, our name actually comes from empowering truth. And we started this out, my co-founder and I. We're both, deeply technical. We've come from just our entire careers have been in data and enterprise systems. And as we saw the world changing, particularly with some of the advancements of technology in blockchain and AI specifically, we wanted to look at this type of technology and really harness it for good. As I've said many times before, technology is agnostic. It's what you choose to do with it. And what we wanted to do was to take these types of technologies like blockchain. We use it as an encryption technology, not for crypto, but to protect your assets, which is your data, and AI to help you own and control your own data and then help you do something with it, very simply put, because data is very complex. It comes from lots of different places now. Lots of your healthcare data, for example, is not just from your electronic medical records, right? It's also your devices, the journals that you have, the images that you may need to do, things that are measuring you for different aspects, the things that you buy, your lifestyle. It comes from all these multiple data streams. And being able to harmonize that data is a very complex problem because it takes, a village, right? Literally. And so that's where we focus our technology, is taking data from anywhere and being able to harmonize it so that we can use it. And the analogy I like to give is that, have you ever seen that movie, Big Hero 6? That where it's an anime.
I haven't. Is it
La la
nerdy?
la la.
If it's nerdy, then no.
It's
Probably.
like a little bit nerdy. Anyways, about a young boy, right, where he has these little nanobots that he wears a headband, and he thinks about the problem that he has, and these nanobots sort of self-form to come together to provide the solution that he needs. So he needs to get from here to here. So the nanobots create an escalator for him to get to where he wants to do.
Well, I need a nanobot every day.
Exactly, right? And everybody needs a nanobot. But what we need are more like these types of data where we can break them down into more granular, smaller chunks. I like to think of them as these Lego blocks of data, and so we secure these Lego blocks in blockchain. And now you can combine these Lego blocks for what you need, because data is not one size fits all, right? The way that you're going to share your data with your primary care doctor may be different from the way that you may share your data with, for example, a marketing research person, right? So we want to, or, if you want to share your data to train an AI model to help with a particular disease or something that you're passionate about. So these are all these different types of uses of data, and it all comes down to data. So we use these technologies to help people, own and control their own data and then do something with it. And so, this is my second startup, and it's the third for my co-founder. Healthcare is nuanced, is complex, especially in the United States where it's for profit, and data scattered everywhere. You have multiple doctors, and the same doctor that's in the same building with another doctor that's on the same system, they don't have that information about you. And they need that information about you to provide you with the best care, because, the data is very meaningful. It represents who you are. We talk about this idea of a digital twin, but eventually this data becomes your digital twin. This is about you, who you are, how you respond, all the things that are about you. And like I said, I can go on forever, but that was the impetus behind M-Truths. We really wanted to do something to help and move the needle. We chose healthcare because it has a big data problem. There's lots of data coming from lots of different places and lots of shapes and sizes. And we want to be able to do something with it, meaningful, put it together in a way that's useful for that specific purpose. If you need it for a model, This is the way you use it. If you need it for what we call like an episode of care, you've broken your arm, and you may not need your entire whole history perhaps around that, but you want data around that broken arm, your rehab, your surgery, all the things, all the MRIs, the X-rays that you've had to take, the medications that you were on for the pain, all of those things. That's really about an episode of care. It's about breaking your arm, and people need to know, because you're going to have lots of people helping you with that problem. You're going to have surgeons, you're going to have nurses, you're going to have loved ones. When you've had something traumatic happen to you in your health, oftentimes it's scary enough, as it is, to not be able to have the data that you need and to have somebody advocate on your behalf as you navigate this incredibly, labyrinthine, process that we have in healthcare. That's where we want to help. We want to help people, own and control their own data, because there's a lot of nefarious uses for data, as you've mentioned, and we want to put that power back. We want to empower patients and let them do something, and we help them do something with that data. So I'm going to stop there, because, like I said, but that's the impetus behind mTruth and what we're trying to do.
And again, as you guys say, we're all patients, and if you haven't been one yet, you will be, or
you will be
working with a loved one or family member who is. And there's plenty of times where I think any of us, I'll just use myself as an example, where you go to the doctor and you're regurgitating the same information over and over again, and you stop and say, aren't you all, for me, I'd say, aren't you all in the same system? Why don't you know these things? Or why am I telling you this all over again? Or I have to remind, granted, doctors are seeing dozens of patients a day. I get that. But why do I have to tell you again when it's in my chart that I'm taking XYZ med or whatever it might be? But so Paul, you having a healthcare research background, which I think we have some similarities from that standpoint, since I think most people who listen to the show know that I'm a healthcare market researcher. But what do you think, and what are your perspectives on what you've learned through research and how mTruth is influencing the journey, the healthcare journey?
I think, to echo Irene, I think the important part is that we remember that your data, your healthcare data, is in essence you. It's everything. It's your blood tests. And as you mentioned, I do have a big problem. Like when I moved to America, within the first couple of years, I got a number of letters about your data may have been breached. What do you mean maybe? I don't like maybes. That doesn't feel particularly good. I went to the doctor. They wanted to do tests again. And I said, I don't want to. Why? And well, because my data was stolen last time. And so was everybody else's. And it was very blasé, the approach to my data. It's mine. I don't want it out there stolen on the dark web or wherever. I want to know where it is, care about my data. So that's a big thing that I think is what drew me to mTruth, was that simple logic of the healthcare data should be owned by the individual. And if it is used by somebody else, there should be explicit permission that you fully allowed your data to be used, and you know how and where it's being used. That seems a basic priority. But then at the same time, and the things are different. Like, going to my UK doctor, they've known me for a long time. They seem to remember me. Maybe it's because I look like Ricky Gervais or something. I don't know. But they always
could be worse, Paul. Could be worse. Yeah.
This is true. Yeah, it's either Ricky Gervais or so I look like fat Kevin Bacon. It's one or the other.
Yeah, both. That I wouldn't.
Yeah, no. Both people are famous. I wouldn't mind their bank accounts. But I think the difference then coming over to America is that I did feel a bit more like it's a conveyor belt. I did change doctors, even though I was going to the same company. It seemed like every time to try and get an appointment. And that's where a recently learned statistics or relearned kind of popped up, and it was just you can Google this, was the amount of medical errors. So it's like 250,000 medical errors or deaths are caused by medical errors. 250,000. Medical misdiagnosis results in around 370,000 deaths. And then adverse drug events, another 250,000. And in part, that's not, there's always blame, but the doctors see a lot of patients, and they don't have all the information when they need it. And again, go back onto the whole banana conversation. It's, I'm back over in England a few years ago, and my dad gets back from whatever doctor, and he said, "Oh, I can have bananas now." I'm like, "Oh, didn't know you couldn't." Yep, the other doctor said I couldn't have them. I'm like, "Okay, well, did you tell this new doctor that the other doctor said that you couldn't?" "No." "Why?" And that is part of the problem, is that with like adverse drug events or really anything, mistakes happen through lack of data, not knowing when to ask or when to say. And so I think in the patient's mind, and I think about, a lot of my friends, well, more the busy mum friends, they're juggling a lot, and their health is the last thing on their mind. Normally it's everybody else's they're looking after. So when they do get to the doctor, and I do this myself, I forget to say things, and I should be better. I know I should be better at that. But having a centralized platform where you can, see all of the data that your physicians have about you, make any needed corrections, and then if you are taking medication, see general summaries of, the foods that you should be taking or not taking. It's like little things. I was chatting to a friend who had tests, and I'm like, "Did you remember to tell your doctor that you're taking biotin?" Um, didn't think about it at all. But that can impact a lot of hormonal tests just by taking biotin.
Yeah, I've heard that. Yeah, I know when you go in and you got to fill out the form, especially if you're a new patient and they ask you what supplements you're taking. That's me. I'm not sitting to fill all that out. Not that I'm taking that many supplements, but I don't know. It's just one of those things like, why do they need to know that? But really, they do, because of medication interactions and things like that.
And you forget, right? I mean, you forget they said, "Oh, what's it called?" And you're like, "Okay, it's some kind of long name, how many milligrams they were." And so people forget. I think that's just natural. And I think the other thing too is that they don't make it easy for you to get your data right now. We want it to be kind of sort of a more easy experience, right? With the Cures Act that, was enacted in 2016, they've really tried to embrace the idea. Now the United States government is embracing the idea that people should have access to their own healthcare records, because there was a lot of resistance, to provide that. And even with the Cures Act, they make it quite difficult, right? So, my family members, for me, it's personal, right? Everybody's a patient. For me, it's personal. I have a family member who's recently diagnosed with cancer, and we wanted to get their MRIs. They dump it on a ROM, they burn it on a CD plate for you. And the first thing I thought about, when they told me, I was like, well, okay, I don't have a CD player. Do you have a CD player? Does my doctor have a CD player? How do you actually look at the data?
What's that? What's a CD player?
Exactly. That's the younger generation. They're like, what's a phone? Why are you doing this? Right.
Yeah, I heard that it's not this anymore. It's like, it's this. Like,
I always,
right. It's something.
Yeah. Like that, or like you're holding the seashell up against your
right, exactly. I mean, it should be like, call me, but it's similar to that. Nobody has that, and to your point, many doctors now, they're pressured to spend no more than, on average 12 to 15 minutes with the patient. I actually access my own healthcare records to see what the experience would be like, and my doctor says I'm fairly healthy, knock on wood. There's over 400 pages about me. No doctor that I'm going to is going to read that. I mean, they don't make it that easy for you, even though they make it available. And we want to make it easier.
Yeah. When you mentioned that we were talking about the data breaches, et cetera, what do you think those those breachers, whoever they are, those pirates of data, what are they doing with it?
Not even the bad guys that we might
It's a
think
good
about doing all sorts on the dark web. It's also, and it surprises me even in the healthcare industry how few people know about the Meta Pixel lawsuit that's going on in healthcare. And what was supposed to happen was that hospitals have a lot of patient data, and they wanted to monetize it. And here comes Facebook, or Meta, as they now are. Said, hey, put this pixel on your website. You can look this up. And what should have been anonymous data. So this pixel allows Facebook to do a certain level of tracking. Hospital gets paid. All seems well and good. But if the hospital or institution that owned the patient data didn't set up the pixel perfectly, it was transmitting de-anonymized data. So there's now lawsuits from like the UK to Florida to Australia. But the problem is that it's not Meta that's being sued, it's the individual hospitals that once had that data. And some of those companies are no longer allowed to trade or to host data right now as a result. So with all levels of data, there is the bad hacker, and then there are companies that are just using your data and not thinking too carefully about the consequences of whom they share it with. So that's two real factors.
I think just to leverage off that, the data is valuable, period, Laura, because, many companies and the nefarious use this in terms of hacking who you are and trying to use that data against you, in terms of building a profile for all these different reasons. There's even people that are not on the dark web who do that. They monetize your data, and we feel that that's wrong. If you want to monetize your data, that's fine. But for us, it's about consent, right? We want to treat this data, your data, like we want to treat our data, because we're all patients. How we want people to treat our data. Do we want people being able to use it and monetize it without our consent? No. I use this as a cautionary tale. I was at a conference. I was a speaker. This was long ago when 23andMe were just coming up to just coming on board. And people were talking about this. One person stands up and says, oh, we think it's brilliant that 23andMe says in their term, I love to read terms and conditions. Their terms and conditions stated outright that says if you send your sample in, they have the right to do what they want to with it. And so, and they changed it when there was a big uproar about it. But now here they are, they're in bankruptcy, and now your data is up for sale. Can you imagine if a insurance company had that data and now could profile you and use that as part of, how they're going to cost you because your genetic propensity for certain things? Is that right? Should they be able to do that? You should have consent on information that's going to impact you, and you don't know how that data is going to be used, but it's very valuable. In fact, healthcare data on the dark web, they charge more for it.
Wow.
It's all in Bitcoin too. That's how they get paid. So there's technology agnostic. What we want to do is to really take a stand and say, this is how you can use data in an ethical way, a good way. We know it's important. We know it's about you, but do it with your consent. You get to control what you want to share, how long you want to share it, and there should be consent asking you, can we use your data for this purpose, even if it's de-identified.
So thinking as patients and certainly wanting to control our own data, making sure it's secure, who's seeing it, who's using it, and how, where does this, I'll just call it a funnel. Where does this funnel start, this flow chart, if you will? Is it starting with the hospitals who are bringing in your technology on their EMRs, or is it something that the patient has to sign up for and then
It's
is
multi-pronged.
interfacing with the hospital? Explain to us how
Yeah.
it works and how someone would get access to that.
Yeah, it's multi-pronged in the sense that we do work with the healthcare providers, but they're slow and risk-averse beasts. Just even signing a piece of paper takes months and months, with no changes on it. And they're very adverse to that. And in many cases, some of them, and we won't say who they are, but many of the softwares that they used, sometimes the softwares act as gatekeepers because they want to control that data.
Mhm.
And so it can be a slow process. It's not to say that we don't want to do that, but it's slow. But ultimately, we want to empower the patients because the patients have a right to do that. We want them to be able to, through our tools and technologies, to request those data easily, and then for us to help them organize it in a way that's meaningful for them that they can now share with the people that they need. It could be their healthcare team that's outside the network or inside the network. It could be their care providers, so, when we took care of my mom and my dad, my sister and I had custodial access to their healthcare records,
Mhm.
with children, for example, if you have a chronic illness, sometimes it's too much for you and you have someone that's helping you, part of that journey, somebody that loves you and cares about you. And that's what it's about. It's about sharing the right data with the right people at the right time. And you control it. We want you to control it because, and if you want to monetize that data, we will help you monetize that data, but it should be with consent. So there's lots of different ways to use that data because it is important and it is data about you. Consider why, the Metas and the Instagrams and the TikToks of the world give away their product for free. It's because you are the product. We're talking scary things, talking about registries where they register people that are on the autism spectrum. Those things I think people should have a right to here's another sort of controversial thing. When I started this business in looking at the technology in 2018, really developing the technology with my co-founder, and we said out loud, people should own and control their own data. It was like crickets, it was like, clutching their pearls, wondering what's happening. But now lots of people are saying it, the governments are saying more so in developed countries, that have nationalized healthcare. But they're starting to say it here now too in the United States, and there's a groundswell, in terms of people, and we hope that that's what our platform brings, right? I like to use the analogy of silk. Just reading a book recently on another nerdy thing, reading about the history of silk, right? So silk by itself, a single strand, is already amazing, right? It has all these sort of strengths. But when you bundle it together and you're collectively as a group, it's even incredibly more wonderful. And that's how we feel about our platform. And that's why we really encourage people to sign up to be part of our journey with us, right? Is that by yourself, it's important to you. But consider what the value that it brings collectively to maybe move the needle, right? To have a bill of rights in terms of what your data should be about and that you should own and control your own data and have access to it. To be able to collectively say, yes, I want to use my data de-identified to build AI models that will find new drugs that affect me because I have a rare disease. This is the power of data. But we want to put the power in your hands so that you decide, right? Because everybody's going to be different, and what's right for you is different from what's right for somebody else. So you get to choose what's right for you. And you get to organize how you want to see that data. And that's really what it's about. So we've put a lot of effort into building the underlying technology so that you can really control the sharing of the data at a very granular level if you want to.
I think the important part isn't really about us, it is about everybody. And we want people to start giving a shit about their healthcare data.
Yeah.
People were so concerned about their cookies and browsing history, they forget where the healthcare data is. That's more of a risk and liability to their futures. And also something that could be utilized in a much better way for them as individuals. Like desperate for a diagnosis. There are a lot of people that are seeking a diagnosis, and a friend of mine got their permission to talk a bit about this, but their child is currently diagnosed with something called Evans syndrome or disease. That's my last name, so of course I looked into that a little bit. it's an autoimmune condition, and there are way too many autoimmune conditions. And 80% of those with autoimmune are women as well, which, lots of reasons. But also one of the other little boring statistics, when I think women consume about 186 chemicals per day in health and skin care products.
Mhm.
And that's double that of men. Maybe that's part of the trigger. Same with vitamins. What is the right source? Where do they come from? And with talking to the individual about their child's kind of diagnosis with Evans syndrome, one of the things that didn't quite make so sense was the cycle of the condition. And it was that the child goes from being this very strapping, strong individual that's got loads of energy running around to being bedridden.
Hmm.
So, like, well, what maybe is the trigger? Is it that when they're ill, they're bedridden, and then when they start to feel better, they then give it a few days, and then maybe they're playing football or soccer again. Maybe there's an allergy in the materials of the clothing that they're wearing. Maybe it's that when they feel better, they're going out and they're wearing some sort of cologne, and that is the trigger, like the straw that breaks the camel's back, that then creates this downward cycle. And the person then had a bit of an epiphany, because what happened was that about the time this all started to happen, there was a website where like the young kids were buying maybe not so legit goods that may look like a real brand, but maybe fake. And so maybe what is happening is that you're getting better, you feel good again, you want to wear your finest threads, and you then go put on your fake Gucci t-shirt, and that is then triggering some sort of reaction that's then causing you to spiral.
Oh, like a chemical or something.
And it's about using data ourselves so we can then start tracking when these changes have happened to us. When did we start to see a change in our health? And start looking at any correlation that's there. We've actually in North Carolina, where I live now, there's young people getting cancer. A long story short, it turns out that these people getting cancer had all gone to the same campus.
Mm.
And so it's something in that building that is, potentially causing cancer. And so with data, and as Irene says, data is agnostic. And we feel that, it's your data, and you should choose how your data is used. And when it is used, it should be there to directly benefit you. And that is to identify underlying causes, or if people around your geo-fenced area are all starting to get a condition, that you should know about that as well. I mean, help get to the solution a lot quicker and faster.
Yeah. Yeah. Unfortunately, we can't all live in a bubble.
Yeah.
But
Right.
that's interesting to kind of geo-target where disease may be prevalent, and thinking about how to use this data in a favorable way, in a more positive way for the good. How would you talk about so as you're helping patients, give control back to them in terms of how their data is being used, how are you protecting their data in turn?
So we view security holistically, meaning that you need to design for security because it's layers upon layers and upon layers. So in addition to everything being encrypted and transit at rest, meaning that it's always encrypted, whether it's moving from one place to another, or it's in a file system somewhere, the encryption is there. In addition to that, that's the reason why we've been expanding the blockchain technology. So blockchain technology was interesting to me for a number of reasons, in the sense that they call it immutable. Very simply put, blockchain says that a parent block of data is cryptographically tied to a child block of data, meaning that it's encrypted. There's a special key between parent and child, like DNA is passed from parent to child. And you cannot delete or edit the data. You can only add to the block. That's why it's called a blockchain.
I see.
And people are using it, for crypto. And the only thing in crypto that's protected in the blockchain is the coin. Well, for us, the coin, and you're simply following this coin through a series of wallets. For us, the coin is not the asset. For us, your data is the asset. So we protect the data in the blockchains foundationally, and we create those blockchains under your ownership, so that it is your data. And we create the tools now to help you do something with that data, that is encrypted in that blockchain. So we started at every level, and we do security at every level. So we also built a lot of capabilities to be able to very granularly share data so that it's not all or nothing, right? You only want to share this one image, this one MRI with a consult, and you only want to share it for, 24 hours. And you want to share it with this one person, or you want to share it with a group of your doctors, your team, that maybe your oncology team, as an example. These are different ways that you want to be able to control that sharing at a very granular level. So there's the functional protection of that. Additionally, everything, like I said, is protected. Even the QR codes that we use, that you can use to share, to scan, the QR code themselves, they're also encrypted, but also there's security embedded in the codes themselves. So we take security at every level. Additionally, our infrastructure is in AWS GovCloud. It's the safest regions in cloud computing in the world. And so we're purposeful in how we approach our design and our applications. And it all starts foundationally with protecting your data and having you own it in the blockchains, and then all the good practices on top of that. So in fact, best practice says your password should be at least 15 characters long. I mean, that's a long password, but think about it, right? The longer the password, the safer it is. And so those are all these little things that add up, because, Laura, it's an arms race, right? People are always going to find ways, to figure out how to get around something. This is in human nature.
Yeah.
You've got this new algorithm. Now we're going to figure out how to protect it. So really for us, it's really about making sure that, if and when data gets breached, we want to try to isolate it and have it be reduced in effect. Because it's not a question of if you'll be breached, it's a question of when. Even with the best protection, it's possible, but we want to try to minimize the impact of that.
Yeah, the hackers are always looking for the loopholes, right?
They're always, so it's always an arms race, in terms of what it is. And so you have to treat, security holistically.
Since we say that hospitals are slow to make decisions, which I'm aware of this, as I mentioned, I've worked in several of the healthcare systems here in the Chicago area. So yes, they are slow. It hasn't changed in the 25 years that I have been working in healthcare. But let's say you're pitching this to a hospital CEO. What's in it for the hospital system? Just if we flip the audience that we're talking about for just a few minutes here, what's in it for them?
I think CEOs, particularly in the United States, right, where healthcare is a for-profit industry, they're going to be looking at two things, their costs, their liability. Well, that's three things, and their revenues. Top line, bottom line, and then the risk, right, in terms of what that is. So in terms of revenue, right, the experience, people are competing for you as a patient. And those ratings that you get, those star ratings, so even having a half a star increase actually translates into actual revenues for you as an organization. So and how do patients measure satisfaction? Patient experience and outcomes. And so it's being able to improve the patient experience, being able to have them be part of that journey, to feel like they are part of, it's about you. Why shouldn't you know everything about you as opposed to people talking about you, and not, you're not being part of that conversation. And then also, being able to have a better outcome because now the data is available. They're not, you need the data in order to provide the best healthcare. Your team needs the data, and it takes a team. It takes a village to treat you for conditions.
Yeah.
And then in terms of costs, for us, if we're hosting their data, for example, we're half the cost of a data warehouse, which is the traditional approach. And then, I've done a bajillion in one of those as a technology consultant.
Oh my gosh, that's like a blast from the past term for me, because I was with the healthcare system back in the early 2000s, and
Yes.
we had a data warehouse, and it was mainly for marketing, but eventually it migrated into more of looking at patient data and how the hospital system can better affect outcomes and things like that.
Right.
Wow, blast from the past.
And then liability, that's something that Paul also, brought up recently with one of the experts. The new HIPAA laws that are going to be coming out, hospitals are going to be liable for housing and using the patient data. So, why not, put the responsibility and share that responsibility back with the patients where it belongs. You may be able to monetize on the patient, in terms of selling their data, but that's not really your primary revenue goal. Your revenue goal is providing with care. So imagine if somebody sues you, like this meta pixel, you've decimated any kind of revenue potential from that. Plus, you've taken a hit in terms of your trust and worthiness. Who's going to trust you if you're doing that with your data?
Yeah. Are
Well,
there
yeah.
hospitals that are doing that? I mean, like, is this
Yeah.
a matter of
There
putting
are.
a widget on your EMR, or, how does
They're doing
So
more
we
than
help.
that.
Yeah.
They're doing more than that.
We help the hospitals kind of future-proof their data. Anybody that houses patient data needs to understand is that, December 27th, 2024, some proposed HIPAA changes were put into place, and ultimately that's going to put a lot more responsibility, and rightly so, on those that are housing the data. So not only is it the amount of hoops and audits that they need to go through per year, increase security, but it's also that as the owner of that data, they are financially responsible for any breach that happens. So I think for a lot of hospitals now, they might at some point seen data as an asset, but now it's not something to monetize. It's something to protect, and something that can cost you a lot of money. You can get sued, and the entire company can go under based on that lawsuit. So and I think it's a good wake up call. I think it right now is a good time, especially with the growth of AI, that everybody needs to take our as in individuals data a lot more seriously. It's not something that should be traded like a Pokemon card. It's in essence that individual. The data that they have provided is to work for them, not so people can just earn money off of their backs without them seeing any form of reward or benefit.
Yeah.
Especially if they're open to risk for it. Because again, none of us want to receive any more of those letters that say your data has been breached.
Right. Yeah. And as far as Care Anywhere goes, so I know we talked a little bit about this before, where I've gone to multiple providers who are not in the same system or same medical group, and they'll say, oh, you saw Dr. So-and-so a few weeks ago about this same issue. And so they know things. So patients who think that they can go to another provider and they don't know that they're getting a second opinion, whatever, through Care Anywhere, doctors know where you've been and maybe what other tests you've had and imaging, etc. How is this different in terms of making data available to all providers, again, controlled by the patient, but assuming that it is available to all providers if you want it to be as a patient? So how is Care Anywhere different?
So Care Anywhere, is like I said, we welcome services like that, right? Because it helps in the bigger picture of really putting the data together. But EMRs are just electronic medical records. It's the systems that the hospitals and your doctors use to capture the doctor's notes and the information about you. And so that's really only one aspect of data. Oftentimes they don't contain the radiology information, for example, or if they outsource the labs on a different system. And Care Anywhere, for the most part right now is more centered around one vendor. And we want to be agnostic around that, because you're going to use lots of different systems, and those systems are meant for a specific purpose. You know what I mean? So electronic medical records were meant to provide you, the doctor, with a system to enter their notes about you, to have triggers to say, you should do this, you should do that. It's part of the workflow as part of a hospital. And so they should choose the systems that they want to do that. But for us, it's about the data. Data should be seamless wherever it comes from, and put it together where you need. So if you have data from your devices, that you're wearing, if you're part of a clinical trial, if you're having imaging, if you're doing rehab, if you're doing acupuncture, or having other other non-traditional medicine, for example, to help you with relaxation and your mental health, your journals, all those things are about you, and you should be able to put that information together about you. And that type of information will not be in your electronic medical records.
Mm-hmm.
So that's really, one of the things that's different. We welcome that, because we want more data, and we want it from reputable sources.
What we believe is that everybody should work together, all companies. Yeah. And again, back onto Irene's word about data agnostic. Yeah. Our system, they should be all systems, work well together. And it's a bit like how Android and Apple and Zoom and Microsoft and Teams, they don't play particularly well with each other.
Uh-huh.
It's that same sort of problem that you face within data, to think of it that way. So with this agnostic approach, the important part is then still ownership, is that it's your data. And that's how people should see it. It's you. Who knows what is going to happen in the next few years, looking at the current path of change with current AI. Protecting your data, taking complete control over it and ownership is more important than ever. So that's one thing that, again, agnostically, we're just urging everybody to do, is think about where your data is going, who is using it, how well are they protecting it, and what's it going to be used for. Care Everywhere, MyChart, owned by Epic, they own 40% of the market so far.
Mm-hmm.
How much bigger can they grow? There are 200-ish competitors to Epic. They just happen to be the largest.
Yeah.
And so we want people to have the ability to use whatever provider that they want, and to have access to their data from all of their providers when they want. Irene was very diplomatic in her response about the level of security, but our security is pretty good. It's a lot more secure than most companies where your data is stored. And so we feel that there should be this complete ring around your data protecting you. It's you, it's the essence of who you are. And with the growth of AI and other technologies in the future, it's increasingly more important to understand where your data is going, who is using it, what they're using it for. And it should benefit you. Ultimately, it's you. It's getting sick sucks. And the older you are, the more difficult that can become sometimes. Trying to get data from multiple sources, it should be there at a touch of a button.
Yeah.
So you can share it in emergency.
There's been talk about electronic medical records, universal EMR, I think, for a really long time. And it sounds like in many ways this would help that, or contribute to that platform wanting to do that. For patients who would be interested in, so there's two points of entry, it sounds like, one from the provider, and two, the patient can sign up. You don't need the provider to be on board with mTruth, it sounds like. So patients can sign up directly through you. How does that work, and what does that service look like for patients?
First and foremost, in terms of like how we our vision of where we want to be, right? And the roadmap that we're going to take, we really encourage for people to sign up and be part of the journey with us at the get-go, from the start.
Uh-huh.
Because like when I was a consultant, I'd tell some of my clients, with time and money, we can do anything you want. but both are in high demand, right? So it's only going to be about priorities. And so we're going to prioritize in terms of our roadmap and our capabilities for the community that's part of our platform. So that's who we're going to focus on. But that having been said, where they come on is they sign on. They have multiple services that they maybe want to use. They may want to participate in a survey, as an example. And if they choose to do that and they choose to do that information, they get compensated for it. For their medical records, they can either upload on their own for information that may be not accessible right now, and also be able to enter their credentials that are provided by their healthcare providers to grant us consent to access the data on their behalf, to pull it into this to our platform that's created and secured in the blockchains that are now created under your ownership, your own individual ownership, and to be able to control and to manage that and share it with the people that you need. So we envision that the service will just get better and easier as we go. That's part of the process for us. But that's what we want to see. We want to be something as simple as a push of a button where the data is available for you, and it's easy to share the data with somebody, the new doctor that you have that may not be part of this Care Everywhere or be part of my chart, and still be able to access your data. And you still get to control, what they get to see, how long they get to see it, and you can rescind that consent at any time.
And it's free. And that's the important part, is that we see it as a team effort. And so for those that want to be more involved with research or sharing their data, they can. For those that don't, again, completely fine. They may change their mind in the future. They may not. But what we do believe is that creating, really a movement around people and their data ownership. And that's the future. It's your data, own it. It should be useful when you need it, like an emergency situation. It's, when you're in pain, when something has happened, you're not going to remember all the details in that emergency room, or same in 10 years from now. Something that you have taken or you have done could have impact to long-term health. And those things that we forget could be the bit of information that a doctor needs to come to a conclusion to understand what your condition is, what that trigger was. It could be a location that you went to where you traveled abroad.
Or some infection that you had, right?
Exactly. Yeah,
that's what they're thinking. They're doing some research now. They're hypothesizing that some infection, that some bacteria that young people had from many years ago may be the trigger, the impetus behind the higher incidences of colon cancer that they're seeing. So there's lots of these. Correlation does not necessarily mean causation, but having the data available and being able to study it and use it as stimulus to think about where you want to prove this problem, I think is all part of the vision of where we want to be in terms of with the data. And one of the things too, again, is like to be easier. Somebody shared with me, somebody that was helping us. She was talking about her grandma that had to be taken by ambulance from her where she was staying to a place where she was getting treatment on a frequent basis. And every time she went, she'd be clutching pieces of paper to her chest, describing who she was and what she needed. And I say, these are the things that fire us up, is that, all you need, if you could just scan or what you have and just say, this is it. This is who I am. This is what I need. Anybody along the way will know. The ambulance people that need to know as part of the transport, but only that information. And then finally, when you get to the clinic, where they're giving you that treatment that you need, what you need and who you are, and list your medications and your allergies to make sure that those things are present. So it could be much simpler, for users. And that's what I think about. I think about the struggles of people that I love and I care about that have been ill, or have chronic conditions, and the struggles that they have just to get the care that they need. Some of them creating these big binders, they carry around that they share. It can be easier. And that's what we want to do. We want to make it easier.
So how does that data collection work? Because so using the scenario of patients who are carrying binders or papers or whatever, and let's say you have seen multiple providers who aren't in the same system, they might not even be in the same state. you may present at an ER for something, and in an ER, they know nothing about you if you're not going to an ER of the system where you get most of your care. How is a patient entering their data, or how is it being pulled? And if they do have stuff on paper, how do they populate their record through mTruth?
Yeah, so we want to support that whole spectrum, right? Because that's what it's going to be along the way. So there's two questions that you asked is, how do they get the data in? And then also, for people that need the data, like your loved one that's your advocate, how will they have access to that data? So the first question is, how to get the data in. We support the spectrum. If you already have, the PDFs, the images, we will give you a capability to upload it into the system and organize it the way that you want. And we'll note that this comes from you. The data comes from you. When we have those automatic pulls from the providers themselves, it'll be in its own different format. We'll pull it in, but we'll harmonize that data for you so that you can organize it. But it'll say that data comes from this provider. So because having the source of the information is just as important, right? We want to know the veracity of this information, the truthiness of this information, right? And that's what, Paul was alluding to with some of the AI systems. The AI systems oftentimes are training with data that are just plain false. They're fake data. And where we want your data to be is not only be in a trusted place, but then when people, with your consent, want to use that information to do modeling, as you mentioned, or to train AI or something, they know that the data comes from a trusted source. They know where that data comes from, because not all data is the same. The data from your provider is going to have more value in terms of the accuracy, the veracity of that information than data that some Joe off the street says, oh, psst, I got data for you. So you have to kind of know where your data comes from. So that's how we support it in multiple ways. So that's, you can manually upload, if you already have this files that you want to secure in the blockchain and organize it the way that you want to be able to share with your provider. And so if you have paper, you can just take a picture of it, and upload it as an example.
Or even vitamins as well, taking pictures of that as well.
Most people have a phone, so take a picture of it and then upload it.
That's interesting, because the automatic polls that you mentioned, Irene, from other providers, do providers have to have certain, I guess, permissions for patients to do that? And do you have to tell that to them to do it, or is that?
So there's a mechanism for that. That's why, the consent is all spelled out, and you're actually providing, we don't see it, but you're providing the credentials that you use to log into your provider's portal.
I see. Okay.
To give access to say, and they'll say, this is what you're asking for. Do you grant consent to provide this information? Yes. Okay. Then we have the right to pull it. And then we build that now we create that data in the blockchains under your ownership so that now you get to control it.
Okay. So you're not going around the healthcare system into
no, not
data,
at all.
Of course, but
it's a data source. It's a very valid data source, and where we want to be right where the source of the data is. So wherever that source of the data is, if it's the EMR, we'll get it from the EMR. If it's from your device, we want it from your device.
Got it. But the patient is giving permission to get into their record to and then
everything is about permission.
Everything's about consent. It is. Okay. Yeah. It is. It's about informed consent, right? You have a right. It's your data. So we want you to treat your data the way you want it to be treated, just like we want it, our data to be treated the way that so we protect your data like it's our own, to give you the right to protect and own your data and use it the way you need. So same thing when you asked about the other question is, how do you share it, right? You get to share who has custodial rights, what I call custodial rights. Your primary care provider should have custodial rights, for example, to your record that may not be inside your EMR data, as an example, right? Other data that they may find useful. If you've already entered all your vitamins, why shouldn't they have an access to that instead of asking you to remember, that 5 minutes out of the 12 minutes you have with them, to give your list of all the vitamins that you've ever taken in your lifetime, to have that information available so you get to share it. And you maybe the loved ones that are caring for you. If you have a chronic condition like you're fighting cancer, you probably have somebody that you hopefully, have somebody that cares about you, that is, working on your behalf, looking at the records, sitting with you, listening when the doctors provide the information that they have. Maybe even those. I mean, that's another thing, right? You may want to record what the doctor has said and upload those so that you can parse it, because when they're sitting in the room with you and they're talking about it, you're shell shocked, right? And you want to find out more about that information. So we give you great power, in terms of how you want to control that data and who you want to share it with.
Provider access it. Is it, here, doc, here's my QR code, but I'm 90 years old and I don't have a smartphone for you to scan that QR code.
You can someone can like they're like, so for, like I said, mine, if I use my parents, they can't even, every time I call her on the cell phone, my mom would hang up because she would press the wrong button and call her multiple times. So there'll be different generations of people that use it. There will be some that are more comfortable, with an application, and they'll use it. But oftentimes, for people that are older, as an example, like my parents, they'll have people like my sister and myself, who will do that on their behalf. It may not be a QR code because maybe we're not there with them, but we can certainly, take that secure link and then, send it, paste it into the portal that you normally have a way to communicate with your doctor.
Got it. Okay.
And we also want as well it to be useful for the doctors. Is what we built and what we believe is that we're all in it together. You might work at a pharmaceutical company or you might be the doctor, but at one stage, you or a loved one is going to be the patient. So when that time happens, let's look out for each other. Let's make our lives a little bit easier, so we can all sleep a little bit safer. But sharing the information between physicians as well. So, a doctor may have one particular patient that they've struggled for 4 years and they've finally figured out the diagnosis. Well, there could be someone the other part of the state or country, exactly the same person. Why would they have to go through the same laborious 4 years of struggle to figure out what that cause was? And to give an example that I'm allowed to share, so a few months ago, met a guy on a plane. Started a conversation. He works in healthcare, and he kind of got excited when I started talking. That doesn't happen that often. But he got excited, and reason being is that so he lived in the US for a couple of years, moved over from Europe, then developed IBS. And long story short, he suddenly had to get a colonoscopy, and it's cost more in America. He still had to wait a couple of months. He was annoyed. He went to go for a run. His knee clicked. So he then goes to take his vitamins. Vitamins. The vitamins. It's my American accent. And he popped the vitamins, and it was glucosamine and something else. And he's taken these same things in Europe. And then it kind of dawned on him that the IBS happened when he started running. And that was also when, he started taking the vitamins again. And these are the same things he was taking in Europe. But for some reason over here, how they're made, it just impacts his stomach. And what if? So then he stopped taking them. Within a few weeks, no more IBS flare-ups. After 2 years of trying to figure out what it was just the fillers or something in the vitamins. And he was like, well, how do I share my story? I'm like, right now, you can't easily. But with
He
this,
comes on my podcast. That's what he does.
Yeah, exactly. One of the girls I know, she's does clinical trials, clinical researcher. And I asked her to come on your podcast, but she's too scared. But she tries to share with everybody. But she had a big struggle getting pregnant, and she's in the UK. And then it dawned on her, well, hang about. This is my job. Why am I listening to the doctors? Let me do my own research. I've got all this data. And she found out that gluten can be part of the problem. And she said, I don't really, people talk too much about gluten. I don't really believe it, but it's much cheaper than spending IVF treatment, even though it's much cheaper in England, right? So she stopped gluten and then got pregnant. And so she
Oh,
now shared her story with a lot of other people on like some Facebook groups that help them as well. But it's those small changes that can make a big difference. And even with a treatment plan with different physicians, it's knowing that some other doctor that maybe has had more of one particular type of patient and he has figured out the method. It's sharing that information. And if we share our data, and again, only if people choose to,
Yes.
it gives people larger data sets that they can then make better informed decisions as to what will more positively impact their treatment path. And that's how it should be. And I hate, funnily enough, there was one of your podcasts, Laura, about being single.
Hmm.
And
thick and single. Yeah. Mhm.
yeah, and so one of the women, she was saying how, yeah, I can't remember, but it was something that there was a perception that if you are single, you are less likely to respond well or accept treatment.
Yeah.
Um,
Or rigorous treatment may be hard on you as a single person. Doctors having biases, assuming that you don't have the right support system to help you through
yeah,
that little, it might be a uh, rougher regimen, but the most efficacious.
yeah.
Yeah.
But the data from it was hardly any real difference. There was a slight difference, but it was by like 0.5% or something difference between if you've got you're married with a support system or not. There's hardly any difference.
Right.
But people making decisions on the difference rather than that statistical difference is negligible in the first place. And my thing that and I could be right, could be wrong, but there's this talk about, well, if I use a sauna 3 times a week and if I play squash, I'll live longer. Does it have anything to do with the sauna or squash, or is it because you're rich and you go to a country club and you got really good healthcare?
Yeah.
Is that the real reason? Is it the sauna and the squash, or is it,
Just better
the level of
healthcare. Yeah.
affluence? Yeah. And
Income is definitely a big determination, but in the United States, we spend more per patient and get less results in other
Right.
countries.
And we're sicker than
And we are sicker,
countries.
and
Yeah.
so I think, there's something to be said, for nationalized medicine because that information is available about you for you. But even in European countries, for example, a friend of mine, is trying to get her nephew into a clinical trial in the UK, and getting information about his healthcare from all these different providers, even though they're on the same system,
Yeah.
was a struggle, and it was just everywhere. Sometimes it's through WhatsApp, email. I'm like, oh, please don't do
It's
that.
all over. I know.
Yeah, they're so unsafe. Email is inherently unsafe to be sending information like that. So I think that there's a lot of different ways that we can help, and I think at the end of the day, as Paul says, we're all patients. We all have our unique experiences, but sometimes collectively we can learn something together, and collectively we certainly have more say, particularly maybe in terms of prompting a provider to be faster with their adoption of things that may make it easier for us, right?
But
Because they're all going to be risk adverse, and same thing. Oftentimes, you're in the United States in particular, the treatments that you get are oftentimes not determined by the doctor, but determined by the insurance.
sure.
What's going to be reimbursed. So
Yeah. Well, this has been enlightening. Hopefully, it will be for our listeners. But how do patients sign up for your service? How do they find you? How do they get to you?
I
just
will
go
let
to the
Paul.
website. Yeah, just go to the website. Just go to truth.com and there's a nice, easy sign up button, and that will get the process started. But we're on a journey together, and we're talking to lots of patients, advocacy groups, physicians. We've got a lot of advisors that are physicians as well. But again, more data. So we want people to tell us their stories as well. So let us know what problems they're having, things that we can help alleviate, and we start working on fixing that problem. And to that in mind, talking to some of the advocacy groups things I just didn't even understand is that I was talking to a woman that runs a breast cancer group, and yeah, having cancer sucks, right? But then what she was talking about, it still blows my mind, is that people target you. They think that you're, vulnerable at that stage, which maybe you are, and they will try and scam you for money.
Oh, shame.
So if you're like, that's what they've got. Like some of these Facebook groups, they've got mug shots of different profiles that will go to different advocacy groups and try and scam people. And so we want to stop this stuff. But it'd be someone like, hey, you've got breast cancer as well, or you've survived it, and I need an extra $400. Can you help? And they pull at the heartstrings of people. And yeah, too much of this stuff happens. There's too much fraud, and we want to stop this. And one of the ways that we can do that is by having our history validated and kept away from the mass social groups where anybody can join, anybody can then target you.
So when people are desperate for a diagnosis, they will
Yes.
they will look to anything and anything. But well, I want to thank both of you for being here today. We've learned so much from you about what happens to our data and how it's being used and not used. And who knows, maybe the next episode, Paul, I'll have you come back and we'll talk about the stuff that's in our food and things we don't know about. And Irene, we'll have you come back and talk more about blockchain and crypto and Bitcoin and how it all works.
Pluto.
And what you learned about life on Pluto, which for Pluto. So what, it's resorted to what, just like a star or something now? What
The dwarf, yeah. In my heart, it'll still be a planet.
those of us who grew up with the science books that says Pluto is one of the planets. Yes. Well, thank you again for being with me today. And everyone, thanks so much for listening. Stay well. And like I always say, keep pushing for answers. Oh my goodness, that's a wrap on another compelling story. Thanks for listening to the Desperate for a Diagnosis podcast. If you enjoyed the show, please subscribe, rate, and review the podcast on Apple Podcasts, Spotify, YouTube, or wherever you get your podcasts. You can also follow show updates and healthcare news on the podcast's Facebook page. If you would like to be a guest on the show, or if you have any questions, advice, or suggestions for our guests, please email me at lauramarie@desperateforadiagnosis.com. Please note, I am not a medical professional, nor am I affiliated with any healthcare, pharmaceutical, or device company. I am an entrepreneur and an independent market researcher focused on helping healthcare organizations better understand the patient perspective. The podcast is not meant to offer medical advice, but to merely share the stories and perspectives of podcast guests.